I've shared about 1,000,000 times that I had a rare stage 4 kidney cancer and this giant tumor on my right kidney, but what type of kidney cancer did I have? I don't share this super often in videos. You can definitely go find it in some of my other videos, but what I had was so rare that sometimes it gets a little bit difficult to describe. And so I often kind of just summarize by saying I have a rare kidney cancer. But this video, I thought I would actually give the rundown again and talk about it in more detail. So, what in the world was this thing? So, this sucker was an oncocytoma. Oncocytomas are typically known to be benign. Metastatic cases are single digits worldwide in history, but mine did not catch that benign memo. When we found it in the ER, it had already spread to my liver in about 15 or more places, which is what gave me a stage 4 kidney cancer diagnosis. Yeah, I'm not gonna lie, that kind of sucked. It also took me like a really long time to get that diagnosis. Like, not just to get diagnosed in general, because everybody just thought I was too young for cancer and had anxiety, but even after I got diagnosed, it took me about 6 months to get an official diagnosis of a metastatic oncocytoma. That seems strange. Couldn't they just biopsy it? Yeah, you'd think so. And they actually did. But that was why all of it was so confusing and so rare, because the biopsy came back and they were like, hey, that thing looks exactly like an oncocytoma, but so do the lesions in your liver. And that's not supposed to happen. So my initial first diagnosis was an unclassified oncocytic renal neoplasm, or I think technically a metastatic unclassified oncocytic renal neoplasm. Ask me how many times it took me to learn how to say that. I ended up pursuing like 1,000,000 second opinions, and I've had a very unique surgery for kidney cancer. Not very many patients with kidney cancer will end up having a liver resection, ablations, and their kidney removed. And that's because once it has spread to the liver, in most types of kidney cancer, doing a liver resection or really big surgery like that might not help the situation or your prognosis. Instead, for other types of kidney cancer, they may be better off with systemic treatments like immunotherapy or TKIs. I actually was on a TKI before I eventually got to surgery as well. But because the sucker was so rare, they didn't think that many of the existing treatments would respond to it because none of them would have ever been tried in it before. So that played a really big part on why they decided to go ahead and try surgery for me, because they didn't think that there was a whole lot that I would respond to, and because this tumor normally, an oncocytoma, is normally benign. So they weren't sure how it ended up in my liver, but there was enough tumors in my liver and they hadn't gone anywhere else. Maybe if we removed them from my liver and from the kidney, maybe it was possible that it wouldn't go anywhere else. So we were kind of taking a chance, but it was one I was willing to take because it was my best shot. It has panned out well so far, thankfully. If you have an oncocytoma, why do you talk about chromophobe kidney cancer so much? Great question. I talk about chromophobe kidney cancer so much because it is the one that is most similar to mine, and we actually thought I might have had it for a period of time. During that period of time, I was able to meet other patients that had it, and I really wanted to help advocate for them after I went through a prognosis change. Chromophobe kidney cancer is very different than the other types of kidney cancers, so I spent a lot of my time advocating for it because honestly, they need treatments. And rare cancers need like really fierce champions, or that doesn't happen. So, summary. I had a metastatic oncocytoma. Oncocytomas are typically known to be benign. They pretty much never ever spread. So I don't want my case to worry other people who have oncocytomas because oncocytomas are typically benign. Mine was just super rare and it wasn't supposed to happen. We did lots and lots of testing on this thing because I had my surgery done at the NCI, which is a research institution. So there will be a case report out on my case one day that has all the details, all the sequencing, every test that they ran on this thing, which was a lot.